It's a rainy day, and we're hanging out, waiting to go see a movie. Meanwhile, Shari and I are in the car, and we're talking about craniosacral therapy. Hey, Shari. How's it going?
Hi, Betsy-Dawn.
So we were talking last night at dinner about how craniosacral therapy has been a therapy that is recommended often for people who have PTSD, right?
Yes.
And you know about this, and you were telling me some amazing things, and I just wondered if you could recount some of that.
Okay. Well, I've had a number of people who have been diagnosed with post-traumatic stress syndrome, people who have been in the service, people who have had automobile accidents, and I've done craniosacral therapy with them and seen pretty magnificent results. Oftentimes the results change physically, and they coincide with emotional changes in their daily expression, especially dream states. So a lot of times people with post-traumatic stress syndrome will have what we call night terrors, and the night terrors start to slow down a little bit or diminish or change
When they go through craniosacral
when
therapy.
they experience craniosacral therapy. So having a trauma, whether it's physical or emotional or spiritual, affects the nervous system via the cerebral spinal fluid, which connects the body and the brain. So we have what's called the dural tube that runs up and down the spine, along the spine, connecting the body and the brain. And this contains a substance called cerebral spinal fluid that then spans out into the body in a sort of spider webbing in the connective tissue. So around muscle fibers, you have this connective tissue substance that has a matrix, a fluid matrix of cerebral spinal fluid. So in the old days, they used to say, oh, the body-mind connection. And, people might not really be able to understand that or think that's a sort of airy-fairy concept. This is science, and it really validates that there is such a thing as the body-mind connection. And so when that substance is altered, when the flow of that substance is altered, it affects the personality. It affects the dream state, it affects the wake state, it affects the way that we respond to the present reality.
Wow.
So it's a very light touch, it's very gentle, it doesn't feel like there's anything really being done to you. So that's maybe why there's so much skepticism around it, because you can't feel it. It's not like going for a massage or especially deep muscle therapy, which is really tactile.
But yet it is, you said, one of the top therapies that are recommended for PTSD folks. Yeah.
And it's recognized by the medical profession because it was, I guess it was validated by an osteopathic physician. So an osteopath is trained in physical medicine and psychological medicine and then allopathic medicine. So they recommend medications. They have the right to prescribe medicine, but they also can manipulate structure. So they manipulate the skeletal system and the musculoskeletal system. So it was an osteopath who popularized this technique, and they did all the studies and mapped it so that it's really recognizable by the medical profession. So it's oftentimes covered by insurance for people post-trauma, immediately post-trauma. So it's really hard to get reimbursed for that sort of thing several months or years post-trauma.
Right.
But in the veterans organizations, for instance, it's recommended a lot. And so sometimes veterans organizations will have a budget for that.
So what's a session like? What can somebody kind of go into a session, thinking is going to happen?
Well, it's important to not premeditate what's going to happen, because that's a sort of a directive. So the therapist or the medical professional that's doing it has to remain neutral. It's more about palpating the rhythm of the cerebral spinal fluid, so we can feel it. We can feel the pulse of the rhythm, and when the pulse is out of sync, that means that there's a stoppage of the flow of the cerebral spinal fluid. So it's a really light touch.
That's fascinating.
And you can feel the bones move, and then you can feel the pressure release. And sometimes people don't feel anything at all. Sometimes they feel a neurological shift. They'll say, wow, I feel that in my toes when I'm just working on their head. Or I feel it in my left foot specifically. You know, it affects the whole neurosystem. So you feel it in different parts of the body.
So when you start to work on somebody, do you specifically go to that area of the body that has experienced the trauma?
Well, there are a couple of approaches. You know, the first diagnostic approach is to do what we call the 10-step protocol, where you just palpate the rhythm of the whole body. I tend to go right to the source. It's not always recommended to do that, but usually people can't afford a lot of sessions. If my services particularly aren't covered by insurance, and it's expensive, so people will only be able to afford usually 1 or 2 sessions.
So that expedites it.
It expedites it. I go right to the source, and then a lot of cognitive therapy goes along with it, so that people are able to process things that come up. So sometimes people will have a big emotional release. Sometimes it's a happy emotional release. Sometimes it's reliving the trauma. So the idea is that once they relive the trauma and identify it as a trauma, that they can objectively realize that there are alternatives to, then they can, with cognitive therapy, psychological therapy, they can turn around their response a little bit. But the most important thing from my perspective, because I'm a body worker, is the release of the cranial restrictions that are restricting the flow of the cerebral spinal fluid, so that the nervous system is freed up. The idea is that energy moves. You can think of it like a river, you know, where beavers come along and they build a dam. You know, the river's flowing along in one direction, then the beavers build this dam, and then it just starts to swirl around.
That's a good way to think of it.
Yeah, so it can be manifest as pain, and it can be manifest as emotional trauma. The body-mind doesn't recognize the difference between physical pain and emotional pain. It's still trauma. So.
All right. So if somebody did not have insurance that would cover it, or whatever insurance they have wouldn't cover it, do you know what kind of typical out-of-pocket expense it would be?
It's probably a range of $80 to $150 for a session. A session could be 50 minutes, or it could be 90 minutes. The only time that it ever covers my services is if it's an automobile accident where the accident wasn't their fault.
Yeah.
So I waive payment in those cases.
Yeah.
But the results are the results can be immediate, like within 15 minutes of a session. Sometimes somebody's face could be contorted and they have a twitch, and their jaw's misaligned, and their cranial bones the cranial pulse has shut down, and then just in a few minutes the jaw can drop and the plane can level, and there's a direct relationship between. It's called craniosacral because we have the sacrum down low and we have the cranium up here, so it's kind of like architecture. You can't really work with the head without working with the lower body. So within about 15 minutes you can diagnose this sort of thing. If there's an imbalance, you can see it. So that's why we do the 10-step protocol, to evaluate the whole physiology.
Is that something that other craniosacral workers do? That's a typical, I think that's part of their initial intake. Yeah.
10-step protocol is the first course.
So is that doesn't mean 10 visits, does it?
No.
Mm-mm.
It's 10 maneuvers.
10 maneuvers, yeah.
It's just to evaluate the whole body.
Yeah. Well, thank you so much. That's fascinating,
You're
and
welcome.
I'd like to share this information.
You're welcome.
All right.